Fibromyalgia is a complex and often misunderstood chronic pain disorder that affects millions worldwide. Characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive difficulties, it can significantly impact daily life. Women are disproportionately affected, with prevalence rates much higher than in men, especially between the ages of 20 and 55. Condition is not only physically taxing but also brings a substantial economic burden due to healthcare costs and lost productivity. Traditional treatments, such as medications and physical therapy, often provide only partial relief and can come with unwanted side effects. As a result, many patients and clinicians are searching for more effective and sustainable solutions. In recent years, researchers have begun to view fibromyalgia not just as a collection of symptoms, but as a disorder of network physiology, meaning that multiple body systems, including the nervous, immune, and autonomic systems, are involved. This new perspective is opening the door to innovative therapies that target the underlying mechanisms of the disease. Vagus nerve stimulation, or VNS, is emerging as a promising therapy for fibromyalgia. Unlike traditional medications, VNS targets the body's own regulatory networks. The vagus nerve acts as a communication superhighway between the brain, heart, gut, and immune system. By stimulating this nerve, either invasively or non-invasively through the skin of the ear, researchers hope to restore balance to the autonomic and immune system. Early clinical studies have shown that VNS can reduce pain, improve sleep, and decrease fatigue in people with fibromyalgia. Non-invasive techniques such as transcutaneous auricular VNS are especially attractive because they are safe, easy to use, and can be administered at home. These therapies work by modulating the body's stress response, reducing inflammation, and enhancing the brain's ability to regulate pain. While the evidence is still preliminary, the results so far are encouraging and suggest that VNS could become a valuable addition to the treatment toolkit for fibromyalgia. Despite the promise of vagus nerve stimulation, there are still important challenges to overcome. Current studies are limited by small sample sizes, short treatment durations, and differences in how VNS is delivered. Researchers are working to standardize stimulation protocols and identify which patients are most likely to benefit. Large, well-designed clinical trials are underway to answer these questions and to determine the long-term safety and effectiveness of VNS for fibromyalgia. In addition, scientists are exploring how VNS can be combined with other therapies, such as exercise and cognitive behavioral interventions, for even greater benefit. The ultimate goal is to move beyond symptom management and develop treatments that address the root causes of fibromyalgia. As research progresses, VNS could become a cornerstone of a new network-based approach to chronic pain, one that is more precise, personalized, and sustainable for patients around the world. Looking ahead, the integration of vagus nerve stimulation into fibromyalgia care represents a shift toward bioelectronic medicine, a field that combines neuroscience, engineering, and digital health. This approach aims to harness the body's own networks to restore balance and health, rather than relying solely on drugs. Wearable VNS devices, real-time physiological monitoring, and personalized stimulation protocols are on the horizon. These innovations could empower patients to take a more active role in managing their symptoms and improve their quality of life. As more evidence emerges, clinicians and patients alike may begin to view fibromyalgia not just as a collection of symptoms, but as a treatable disorder of network physiology. With continued research and collaboration, vagus nerve stimulation could help transform the landscape of chronic pain management, offering new hope for those living with fibromyalgia.